Okay, I'm hoping that there are some people out there. And if so, welcome to this first webinar that we're holding. We're hoping to hold these every week in order to just give you a chance to hear a little bit more about what's going on across the Trust through this incident, and also to give us questions or feedback about anything that you would like to hear more around, or any actions that you want us to take. So a big welcome to all of you. I thought I would just start with a very short reiteration of my thank you, which I hope you have seen in the daily messages that we've put out and in the webinar that we recorded message last week. So I'm hugely grateful to all of you at continuing to step up through such difficult circumstances, and please don't think that I underestimate the strain that is on everyone from a personal point of view and in a working situation. So just thank you so much. And that goes for everyone. I know it's not just the people right at the front line, but people who are making sure that we get the food delivered and cleaning the places where we work and doing all those important supportive tasks. Thank you. The current situation in CNI, we continue obviously to have a significant number of staff who are either unwell or self-isolating. We're in about the average range with other organisations. And so again, my thanks to those of you who are covering for other people, but we are managing to cover our services, our core services, and obviously that's the most important thing. We have 15 patients who are on our wards positively tested for COVID. The majority of those, as you will know, are being looked after on Sapphire. So that is our designated ward in general for people who are positive for COVID. And my thanks to everybody who's working on that ward for how they've got it all working so well. We do have a small number of positive patients also on Garnet, and then a couple of others who've got mild symptoms who were able to isolate on other wards. We have, of course, set up our triage unit, which is keeping a lot of those people who would typically have gone to A&E with concerns about a mental health crisis. So that's operating really well from the St Pancras site. And again, I just want to thank everyone for getting it up and running so quickly. And I hear it's going very well indeed. I've certainly had good feedback from my colleagues in the acute hospitals who really recognise that we've done all we can to keep people away from accident and emergency wherever we can. We've also got our revised iCope offer, which is going out to support people who are feeling very anxious in these very difficult times. And again, we've had very good feedback on the speed of response that people are able to get. And there's an awful lot of information out there about how people can help themselves in this really very challenging time. And then probably just the last couple of things from me. I do know that those people who are working in the community are doing a fantastic job supporting everybody, the higher risk patients particularly, but virtually supporting many of their caseload as well. So thank you very much. You might feel as if you're unseen in the work that you do, but we really do recognise it and see it. So thank you. And lastly, a thanks to the people who've been working on our technology, because I hope that you, like me, are finding that you can do more and more virtually, and we really have stepped up our capability. It may not be there perfectly for everyone yet, but it's increasing and improving week on week. And in fact, Microsoft Teams is now being rolled out to everyone. So I hope that as time goes on, you will see that you can do even more and have good, resilient IT that supports that. Now, if you've got any questions, you can submit them using the Q&A icon on your screen, and we'll get through as many as we can. If I can't answer the question, because I'm not going to know all the answers, then of course we'll get the answer and we'll put all these questions and answers on the website anyway, so you'll be able to find them. We'll also put an email of today's webinar out so that people who weren't able to join live, so to speak, will be able to catch up later. So I think the first question that's come in is a question that's asking me to look into my crystal ball and asks how long I think this current situation's likely to go on for, or how long do I think we'll have to operate in this kind of emergency level. And unfortunately, as I'm sure you can guess, I'm not going to be able to give you an answer, a specific answer to that question. I think it would be reasonable, as you can hear from all the talk that goes on nationally and in the media, be reasonable to assume that we are definitely going to have to work like this until the end of May. We are in London slightly ahead of the rest of the country in terms of how our numbers, case numbers are growing, and the expectation is that we will start to get to surge levels within the next week, and then we will probably stay at that kind of peak level for 4 to 6 weeks. So that would take us to the end of May, and I think that's probably reasonable. What we don't know, because of the social distancing measures that have been put in place, we don't really know what impact they will have. It's too soon to say. We can see at the moment that we've flattened the curve. We have to see if that continues. There's a possibility that that may push that curve out a bit, so it may go on for a bit longer but flatter. So I'm afraid we are in somewhat uncharted waters, but the data is being analysed on a daily basis across London and nationally, and I get good feedback on that from my daily London calls. So as soon as I get any more information about that, of course, I'll let you know. Somebody's asked whether we're using volunteers. Obviously, we've got existing volunteers that we already had working in the trust. And although initially I think they were stood down, we are now getting them back on stream, and we will be using them. And of course, they've already gone through all the training and induction and DBS checking and all the rest of it. So we really want to use them where possible, even if it's just telephoning some of our service users who would benefit from just a kind of a check-in chat on the phone and a bit of social contact virtually. We do anticipate that there'll be volunteers coming out from that central call that you'll have all heard about on the media. A huge number of people put themselves forward. We're not managing that locally, that's being managed centrally. And those people who were put forward would have gone through a central checking process, and again will be allocated. It's for us to say if we've got some task or some particular thing that we want help with, whether that's delivering prescriptions or food, or whether it's ringing people up, again, just doing a check-in call. And quite a lot of that use is being coordinated through the local authorities. But of course, if we have a need, we can just put that forward. So just let us know if you think that the team you're working in or the bit of the service you're working in, you can see that would be valuable, and we can look into that for you. I've got another question here that's asking what happens when a patient is diagnosed with COVID. Clearly, when that happens, we make a judgment about the level of their symptoms. And as you heard me say at the beginning, there are some instances where we're able to keep people quite isolated from the rest of the patients in the ward and look after them without moving them. But where people have got more symptoms, or where it's not so easy to keep them isolated, then what we are doing is cohorting those people in Sapphire if they are younger adults, and looking after them there. And of course, primary at all times is making sure that that individual is in the best nursing environment, but also that we are putting arrangements in place that keeps the rest of the patients that they were previously with, keeping them safe. So we're definitely cohorting people in a way that can keep everybody safe. I've had a question here that says that staff are very tired, and I absolutely recognise that. Everybody's working flat out, longer hours probably, and if you're like me, you're probably just feeling it's more intense. So even if you're only working your usual hours, you're still feeling absolutely exhausted. And I'm trying to read what the rest of this question says. I think it's saying it's hard to take leave with so many people off sick, and can we rotate into other roles? We certainly can. And if you are feeling that you are too tired to work, then you really must raise that with your team leader or your manager, and appropriately take some time off. If you absolutely need to have some time off, then you do, and we will be rotating other people into cover. Of course, we're asking people to only take leave where necessary, because we have so many people who are off because they're having to self-isolate, because family members are unwell, or because they're unwell themselves. So of course we are asking people, if at all possible, to work, please work. But we also are really concerned about everybody's well-being. which is why we've put out the wellbeing service and quite a lot of information for you, which is on the website. Please do check. But if you don't feel well enough or you feel too exhausted, please tell us. And as suggested, you can either be redeployed to something that's a little less onerous, a little less for a while, so that other people can shift in, or if need be, take some appropriate time off. Perhaps it's appropriate for me to say now, this is, unfortunately, as you heard me say at the beginning, in terms of the length of time, this is not a sprint. It's not just 7 days, work flat out, then we're through it. It is going to be a longer marathon, and we can't have everybody falling over midway through that marathon. If you're a runner, you'll know what that means. In terms of the new Triage Center, somebody's just asked whether it's been successful. The feedback that I've had so far is that it is. I haven't heard any concerns about it. Clearly, some people still are needing or are taking themselves into A&E, or because there's some concern about their medical state, they're needing to go into A&E and then perhaps be transferred back to the Triage Center. But it is working very well. I've also heard that staff like working there a lot, which is understandable actually, especially now with the A&Es being quite so full on. So as with many other things that we have done through this situation, I'm sure there'll be some things that we think at the end, gosh, wouldn't it be quite nice if we could keep that going? And actually, one of the things we're starting to think about is how we gather those lessons, what's worked really well, that we don't want to stop or stand down as we get to the end of this incident. But what is it that we want to see if in some way we could keep going? And who knows, maybe the Triage Centre would come into that category. If you've got thoughts about that, just beginning to, in our spare moments, have a think about it. So do share any thoughts that you've got. In terms of, I've got a question here about staff testing, which doesn't surprise me. We've had obviously a lot of national conversation about staff testing. I don't have the actual figures and details to hand, so please forgive me, but we'll make sure we get them out by close of play with the questions and answers from this webinar. What I do know is that we are getting slots that are opening up now, and so we are trying very hard to make sure that we use those slots, and we are identifying staff who we think could and should be tested, and trying to get people to go to the national centre. We're also setting up some more local arrangements. I know that Dean was talking to the Whittington about possibly even getting some swabbing done quite locally. So just keep looking out for that information, because we're stepping up our testing arrangements as quickly as we can. You probably know that there's a prioritisation that's going on nationally, but particularly locally, which is identifying obviously the sort of the critical staff groups. Mental health absolutely seem to be part of that, but it is just taking us probably a few days to get those numbers of those tests really ramped up. There's a question here about working from home, and something that says there seem to be a lot of non-clinical staff wandering about. Not sure that I've seen a lot of people wandering about, so I'm very interested to know where that is. We absolutely have people working from home. So the majority of non-clinical, non-frontline staff, we are asking to work at home as much as possible. If they can do their job from home, to do their job from home. Clearly, it's also, in some areas, it's helpful to have just a single representative in the building who can deal with anything that needs to have a kind of immediate presence here. And the executive team are doing much the same. So some of us are working from home, others are coming in, we're staggering that, so we're definitely not all in at the same time, but we're trying to make sure that there's particularly always somebody here who's got the operational experience, so that if there is a particular incident or issue that really needs someone here, then we can respond to that. If you feel that you're seeing people wandering around and you're wondering why they're not working from home, then of course feed that back if there's kind of specific areas that you've noticed. But generally, I have to say here at St Pancras, the building's pretty quiet. and most people are working a lot of their week from home. And I'm very grateful, as I said at the beginning, I'm grateful to IM&T because they have really ramped up and they're continuing to roll out all that we need to be able to do that effectively. And I'm sure that's one thing we'll all want to keep going on afterwards. Somebody here has said that they're worried about service users who really need a face-to-face contact and are concerned that they can't cope with technology or use a video call. And maybe I might not be the right person to answer this in the detail that perhaps you want. So I'm going to make sure that either Andy or Dean just add a bit more to this response when we put the question and answers out later. Certainly what we are asking people in the community to do is to prioritise, to work out, to identify those service users that obviously are higher risk or a priority, and again to then sort of sub-identify those that can be seen virtually and those that do need to be seen face to face. And we do recognise that in some cases community staff are needing to go and see people still at home, and they're being supported in how they can do that safely for them and safely for the service user. If you think that there's a problem with the way that that's currently operating, and that there are some service users who are not getting the support and are in that higher risk or higher priority category, please raise that with your team leader or your divisional director. Just let us know and let's make sure that we look at it again. We are, of course, also trying all the time to increase the technology available so that more and more people can be seen virtually. So that's another possibility. So just if you feel there's an area where we haven't got it right yet, just be quite specific. Tell us where that is. Tell us where exactly you're working, and let's pick that up for you and see what we can do. There's a question here about money. Will there be more new government money to help, is the question. So first of all, just let me reassure you that we have not been told at all through this incident that we have to worry about money. We're not progressing at the moment any about SIPs. There's a recognition that some of the things that we had expected to do that would be adding to income, we can't do through this particular incident. And we've had absolute reassurance that any of the costs that we incur for managing through this incident will be met in full by the centre. And we are, on a monthly basis, we're putting together an identification of those costs. So things like the new Triage Center, there's a cost associated to running that. Those are the sorts of costs that we're identifying all the time, and we're expecting full repayment. And of course, additional staffing costs from covering people who are unwell. So again, if you feel that there's something that we're not doing, and you're worried about mentioning that because you think it's costly, or you think that there's a reason why we can't do it is because of cost, please tell us, because there shouldn't be any breaks being exerted. And of course, we've got to be sensible and use money wisely, but we are being just asked to identify the money that we need to manage this as well as possible. Somebody's also said that they're a little bit worried about cuts later on. I'm certainly not aware of that, and I think if you listen to the national conversation about health and care services, you probably get a sense that actually people are recognising that that funding for health and health and social care needs to be improved going further on. So I do not expect there to be some kind of huge set of cuts that comes later. Somebody has asked if there's plans to furlough staff who have to stay at home, and again, that is not something that's been a conversation that I've had at the centre. Most people who are having to stay at home are working from home, or they're unwell or self-isolating, and all of those people are being supported. And I'm not aware of furloughing, so I will check whether that's a message that's gone out anywhere, but certainly not something that's come to me. Somebody has again asked me to put my crystal ball in action, and is questioning whether we think that this long period of isolation is likely to provoke or lead to mental health problems increasing perhaps across the wider community. I think this is a genuine worry, and it is something that we are thinking about here, and we're thinking about it nationally. So I think there is an expectation that both people who perhaps had a fairly low, fairly mild mental health issue, this might well exaggerate it, create further problems for some individuals. And it is of course possible that some people that weren't previously experiencing particular mental health problems may do. A number of people will of course be very anxious, but I'm probably sure we're all very anxious. A number of people will experience grieving and some degree perhaps of trauma for the impact of this this really horrible incident. So we are, just to reassure you, we are thinking about that both at the national level and playing our part locally, and beginning to think what we're calling a mental health surge look like. So if it is possible, as we start to come out of the actual epidemic, that we might start to then see a surge in people coming forward with mental health needs. And that's another reason why I say I think cuts to our services are unlikely, because I think that is highly likely to be recognised, and at the centre there's likely to be an identification of some further resources to enable us to support that. I think if a crisis can have some good impact as well as bad, I think this crisis has actually brought into very high profile, not just the dependency that we all have on really strong and resilient NHS services for our physical health, but also for our mental health. I'm going to probably just take one or two more questions, and then I think I'm going to draw this to a close, because we've been going for almost half an hour. So somebody's asked me about staffing levels. As I said at the beginning, I think our staffing levels are probably about average, along with other organisations locally. We have somewhere between 25 and 30% of staff off at any one time. That's not counting those people who are working, but are working from home. So we're managing those. We're all the time modelling the number of people who are off, who we can anticipate coming back to work, because they've been symptomatic, and we can model through that at some stage they'll get well and they'll come back into work, just as of course some people will either have to self-isolate because of family members, or will start to be unwell themselves. So we're trying to crunch the numbers the whole time and make sure that we're managing the staffing resource as best we can. We are of course having to redeploy sometimes people who normally perhaps don't work in a particular setting, and ask them to come into that setting, so that our highest risk, highest priority services can continue. And I'm really grateful to all of you who answer that request and agree to be redeployed, because that's what we have to all do. We have to all work together to try and get through this time. I've got two last questions that I'm going to take, if that's okay. I've had a question about PPE. Again, I'm not surprised, because again, there's been a lot of conversation about this in the media. We have at the moment had good supplies. I think early on there were some distribution issues with PPE. We didn't run out completely, but we certainly got quite low. We had good deliveries at the end of last week and over the weekend. I am actually pretty confident, and this person's asking me if I'm confident. I'm not a crystal ball reader, sadly, but I'm reasonably confident. I think a lot of work's been done nationally now on getting both the supplies and the distribution working better. Some of you will know that goggles and visors have been a particular issue, but we are aware that there's a number of industries or organisations that don't normally produce those kind of goods that have turned their minds to that. In fact, in this part of the world, in Knowledge Quarter, we've had some good support from the CRIC and others in thinking about how they could quickly turn the technology to producing more of those. So I am actually feeling a much greater degree of confidence that we will continue to have that flow of PPE that we need. And if you, of course, are experiencing any particular issues, raise them before you get down to the very critical point. Raise them, because we can move things across. And as organisations in this part of London, we're helping each other out all the time. If a particular organisation suddenly has a bit of a dip in some area or another. And the last question is just recognising that there's been some food deliveries that have started as of this week. I'm very grateful to everyone that's helped out with those. So we put together snack packs. Thought that was a better response than just having hot food in the canteens, because not everybody is on the acute sites and has access to those canteens. It'd be great to get your feedback and hear whether those have been appreciated, or whether there's indeed anything else that you think that we could do that would help. But they will continue. And so from this individual, who I presume is pleased about them, so asking if they can carry on. Yes, we have plans to continue that. And it would be great to hear from you if that's being appreciated, or if that's helping out at all. We don't want you being distracted, worrying about how you're going to get food and drink during the day. I'm going to wrap up there. Thank you so much for joining today's webinar. We are going to hold these, as I said, regularly going forward. Be great to get your feedback. Is it a format that works for you? Is it valuable to have this on top of the daily sheets that we put out, the communications? And is there anything else that you would like us to do that would help at all, particularly in terms of how we keep engaged and communicating through this time, or any ideas for something that you would like to see us doing? I look forward to getting your comments. Please stay safe, and thank you once again for everything that you do. You're all amazing heroes and heroines. Thank you.